Hello, everyone. This is Ignatius Bao. I'm a consultant to the National Protecting Immigrant Families campaign, and I want to welcome you to this webinar, How Community-Based Organizations Can Help Us Document the Chilling Effects from the Proposed Public Charge Regulation. Everyone will be in listen-only mode except for the presenters. We will be recording the webinar so that it is available to people who can't join us, and we will be sharing the slide deck after the webinar is over. Next slide. So today we're going to hear from a number of organizations that have been working on trying to document the chilling effect, knowing that the public charge regulation is still a proposal but may be issued at any time. Next slide. So as many people know, who are joining us, the proposed regulation was issued in October, and the comment period was concluded in December, that there were over 266,000 comments submitted, and we are still working through those comments to see the breadth and depth of the types of arguments that were made opposing the regulation. However, we still do not have a specific timeline. We have heard news reports that the regulation may be imminent. We see in postings to the Office of Management and Budget that is still plans to issue a final regulation, but we do not have a definitive timing. Meanwhile, we know that there is still a lot of confusion and fear in immigrant communities, and that's why we're having this webinar to help us document the effect of even the fact that it remains a proposal at this point. Next slide. And so for those of you who have been part of the Protecting Immigrant Families campaign, this is a review that the campaign was started in 2017, and we now have over 350 active member organizations. We encourage you to join the campaign if you are joining this webinar but are not part of the Protecting Immigrant Families campaign formally, and we'll talk about that at the end. For this year, next slide, we really are focused in the campaign on continuing to document this chilling effect and to try to do community education and outreach to reassure immigrant communities that the law has not changed, that this is still a proposal, and that they should continue to receive Medicaid, SNAP or food stamps, and public housing in the same way that they have when they are eligible for those programs. At the same time, we are continuing to do everything we can to block and delay the final rule if it ultimately does come out, preparing congressional action and preparing for litigation, as well as more outreach to all our member organizations. And then finally, all of this is to build support for an affirmative vision in which immigrants and refugees and asylum seekers are more included in our society and are able to access the kinds of basic safety net programs that are at stake here. So next, I'm going to turn to Lena O'Rourke, who is from O'Rourke Strategies, also a consultant to the Protecting Immigrant Families campaign, to talk about a fact sheet that she compiled documenting the chilling effects. Lena?
Thank you so much, Ignatius. And thank you to all of you for joining us today. Really quickly, I wanted to tell you about this resource we have available, both because it's a useful tool now, and I think also because it frames up a lot of what the rest of my colleagues will present in the rest of this webinar, the need to really document and collect the stories of the harm this proposed rule is. Next slide, please. The piece we put together really looked at what's happening now, even though the rule is not final, and what the impacts were and how we could put that on paper to really make a compelling and concise story of what the chilling impact means for folks. Next slide, please. To do that, what we did was think about what the story was that policymakers, advocates, and the media needed to do. What do they need to know? How can that information be portrayed? And looked for stories that would really back that up. So we hit some bumps. It took some time to find the stories and the pieces. We had lots of information and stories about the chilling impact of this climate of fear and hate. And we had lots of stories about what immigrants are experiencing, but it was sometimes hard to sift out the specific impacts of the public charge piece. Also, we had to really think through how to collect the stories from the outreach workers, from the direct service workers, in order, next slide please, to put them into this piece. And what we ended up doing was collecting from a variety of sources, from news reports and news stories that reporters had done a lot of research, and excerpting from those. We went through the submitted comments to regulations.gov and pulled directly from comments that various organizations or service providers did. And we also found first-person anecdotes from outreach workers and others to attribute and to put in. And the result really was compelling and a really useful way to show the very real impact across sectors of what individuals and families are doing today. That resource is available and live on the PIF website. If it's a good framing for the work going forward, I think it's a great one-pager to hand out. It's a great one-pager, again, just to ground the conversation and to think about what you're doing. But that resource is available and on the PIF website. So with that, Ignatius, I'll turn it back to you to keep us moving.
Great, thanks, Lena. So our next speaker and presenter is Mayra Alvarez from the Children's Partnership. She is the president of the Children's Partnership and has been doing a lot of work in California and throughout the country on documenting the harm to children and families in immigrant households. Mayra?
Thanks, Ignatius. Next slide, please. Good morning and good afternoon, everybody. I really want to thank Ignatius and the Protecting Immigrant Families campaign for inviting me to be here with you today, inviting the Children's Partnership to join this group. For those of you that don't know us, we're a California-based children's advocacy organization committed to improving the lives of underserved kids where they live, learn, and play. And we seek to advance solutions identified through the intersection of research, policy, and community engagement. In our state of California, half of all of our kids, half of 9 million children, have at least one immigrant parent. So our work to advance their health, their well-being is inextricably tied to the issue of immigration. Next slide, please. Knowing that to be true, we experienced a number of challenges pretty early on in our work to improve enrollment and information awareness regarding health insurance coverage for families. As many of you know, California is often looked to as a leader when it comes to taking multiple steps to create a more inclusive and welcoming environment for immigrants. We have passed legislation to expand Medicaid to all undocumented children, for example. We've passed legislation to create safe schools, requiring school districts to create welcoming environments for immigrant students. We passed the California Values Act, which requires our counties to really create these welcoming environments. All of that has been within this context of the national environment that isn't speaking that same message to our immigrant communities. And so regardless of what was happening at the state level, you still saw these headlines in our communities of parents being detained in front of their children, of parents being deported, of people being arrested in spaces that were once considered safe and welcoming. And that sort of story really spread like wildfire through our communities. So much so that our own team in their community engagement work in trying to talk to families about enrolling their kids in coverage and going to the doctor to stay healthy, they were getting more questions around immigration. And that's when we started to know and really feel that our work to promote health and to advocate for children's health was not going to be enough if we didn't consider the issue of immigration. and that we would be doing a disservice if we don't better understand how immigration is impacting California children and their families in order to advocate appropriately for these families' needs. Next slide, please. So as I jump into the presentation, I want to tell you that all of it really is linked to the why behind our advocacy for children. In our work to advocate for kids, we want to make sure that children and their families are heard by policymakers, that there is a children's lens on the issues that our policymakers, our elected officials are moving forward, and that we know the stories and the experiences of families on the ground. Research allows us to better tell that story, to better elevate community voice, and be partners with communities in our advocacy. So 3 overarching reasons for why engaging in research is important is what I'll talk about. So the first being anecdotes versus data. The second is research as an advocacy tool. And then finally, the power of partnership. So next slide, please. So many of us in the nonprofit space know that resources are scarce, and we're constantly having to fundraise in order to pay rent, pay our staff, do our work every day. There's an underlying foundation of resources that's needed to operate a nonprofit. At the same time, when we were experiencing all of these challenges, we also knew that we needed to tell a more accurate story. We had been hearing anecdotes for quite some time, whether it was clinics on the ground that were telling us people weren't showing up, or our staff getting asked these questions and then being told by funders or by other partners, well, how many families and what percentage of families would you say? Or reporters calling and saying, can you connect me to a family that's been going through this experience? And we realized that our anecdotes, our gut feelings, our conversations with the partners on the ground weren't enough for some folks, and that we needed quote unquote data to tell that story more accurately. And at this time, it was probably early on in March 2017, that we also realized that as an advocacy organization, we couldn't do that alone. So I'll talk about partnership later, but we knew that there were others in this fight that could do it with us. So we went into a research project, a very comprehensive research project to better understand what was happening. In the fall of 2017, we did a provider survey where we worked with the California Primary Care Association to interview about 150 providers and community health centers about their experience. We also did a series of parent and youth focus groups in the Inland Empire, which is outside of our urban center of Los Angeles, Riverside and San Bernardino, as well as the Central Valley here in California, as well as obviously Los Angeles and other areas with large immigrant communities. We did that intentionally in order to better understand what the environment for families was in these non-urban centers. We are very fortunate in California, as I mentioned, to have urban centers that are very engaged in these issues, and health providers that are also doing their best to inform themselves and support families. So we wanted to understand what was happening outside of those areas. We also did a family survey. About 495 immigrant families or immigrant family members responded to this survey. We asked that the family have children, that they be immigrants, and that they be throughout the state of California. We enlisted a number of organizations to help us distribute that survey, again, recognizing the challenge of the environment that we were in and the need to have trusted sources. We also did a series of focus groups regarding the public charge regulation, again, to better understand what experiences families were having in this context, and also to ensure that we were incorporating those experiences and perspectives in the messaging, particularly leading up to the close of the public comment. We were hoping that the focus groups could give us information that would strengthen our advocacy against the public charge rule. So we held those focus groups. And then we also held a community and symposium earlier this year that invited new partners to better understand the impact of immigration enforcement on children in California. And then related to all that is a policy and action agenda. You know, from one of our focus groups, one of the quotes that a young Latino male shared with us said that it's like hanging from a string that can be cut at any time. If anyone knows research regarding brain development, regarding stress, toxic stress, It's the idea of this daily pressure and ongoing worry that truly has health impacts on children's well-being. And as advocates for health, to not consider immigration is to truly ignore very negative impacts on health of California's families today. Next slide, please. So this is just a quick snapshot of the qualitative research from the focus groups, as well as our written surveys. The comprehensive set of information is in our Healthy Mind, Healthy Future report released in the summer of 2018. Next slide, please. So the second thing I wanted to talk about was research as an advocacy tool. So this is just a snapshot of recommendations that emerged from our research with children and providers and families. What I wanted to talk about at a higher level is the fact that it can be an advocacy tool and that it does inform our work. For example, many in the health advocacy space have talked about integrating community-based programs and community-based workers into healthcare for a number of years, recognizing that it's important to understand the many different factors that impact someone's health. But now we can point to our research with immigrant families and demonstrate how important it is to integrate community resources into our healthcare system, because that's where immigrant families are going for information, for care, for support. And that is a direct input from the research that we did. Similarly, in our research, we asked families, where do you get your information? What are sources that you trust? From that, we know that it's that they not only get trusted source information from people that they know, but also schools and other providers in their community. So that really spoke to the building of capacity of providers, of educators, and others who interact with immigrant families, really giving justification for why we would want more resources to our schools to learn about what this means for children, or more resources for our county agencies to be trained on these issues so that they could better serve our families. The research provided justification and background in order to strengthen our advocacy for families and to ensure that it really does reflect what families on the ground need, not what might work or what might sound well. So we wanted to ensure that our research doesn't just sit on a beautiful pamphlet of papers, but that it actually is translated into advocacy and strengthening our systems for the families that should be able to benefit from them. Next slide, please. And then the last part about the why behind research is the power and partnership. I mentioned this in passing early, but I do want to emphasize that none of our research would have been possible without the partners that were engaged in this work with us. You know, a critical source of partnership, of leadership, and of guidance was the California Immigrant Policy Center for us. The Children's Partnership was new to the immigration advocacy space, and we knew that we had to connect ourselves and learn and make sure that we had strong partners. And we went with the California Immigrant Policy Center, given their leadership, and they've been with us every step of the way, and we've been grateful for that. It was that partnership that opened doors to many other organizations that could connect us to families on the ground, that could help us spread the word about the survey, that could help recruit for the focus groups. We had an advisory group as part of our research project that also incorporated representatives from the immigrant advocacy community, again, to ensure that it reflected what they were hearing, what they knew from their experiences and the experiences of their members. In addition, part of that effort to do the research was to find out who the experts were in the research. So Lake Research Partners, who has done this sort of work for a number of years, worked with us to ensure that we did our focus groups and our surveys with accuracy, and we're grateful for their guidance. The California Primary Care Association was a critical partner in our provider survey. It's their connection to the clinics on the ground that allowed us to reach those 150 providers. And then the California Program on Access to Care, which is a research support program through the University of California at Berkeley, really helped provide resources for the analysis of the survey data with the Primary Care Association. It was these partners and a number of others that we surveyed, that we talked to, that were key informants, that really helped make this research come alive and really allowed us to build a bigger base of advocates or partners in our advocacy for children and immigrant families overall. Next slide, please. And then finally, I want to close with some of the challenges. I've talked about the work and how important it is, but I want to be really honest and say it's very difficult to engage in this work. First and foremost, I tried to make it somewhat fun, and 3 R's. So one is reputation. The idea that a community-based organization or a nonprofit who is not affiliated with a research university can do research is not always accepted. Many of the times when we would talk about the need to do this research, it was sort of, what have you done and where have you been and how are you equipped to be able to do this research? So it felt that we had to align ourselves with someone that already had a reputation, that already knew or was well known in the research space in order to get accepted in our research and the need to do this research. Since the beginning of our research effort, there's been a number of others that have engaged in this important work. And frankly, even before we started, there were a number of others that were already there. But the issue of reputation and who is given credibility to do research was a particular challenge. The second is restraints. I think there are limitations to what research is possible because of our size, our scope, our resource level. So many of our focus groups, our surveys, were based on the connections that we knew and the connections our partners knew. And because of that, there are limitations in our research. We do not have enough representations of Black immigrant families, for example. We needed to have done a better job. We needed to have done a better job with Asian Pacific Islander immigrant communities. We did sample them some, but not enough. And we know that that's as a result of restraints or limitations that we did have on our time, on our resources, and even on our partnerships. So what more could we have done? But recognizing that those restraints tell a story with that research that we have to acknowledge in order to be fair to the experience of these families. And then finally, resources. I think research can be very expensive. It's very time consuming. It takes up not only the staff time, but also the resources in the partners involved in that, whether it's the research themselves or the university investigator that's doing the analysis or anything you can think of. There's a number of resources that go into making research high quality and important in this environment, not to mention time. Much of this research was urgent and we needed it yesterday in order to be able to tell that story. And that's something we definitely don't have enough of. So the challenge of resources and making sure that there is general operating support to do this research, or that nonprofits are given the flexibility to work with their dollars to do this research because it will lead to additional efforts for the future is a constant challenge. So with that, I will close and hand it back over to Ignatius.
Thank you so much, Myra. We'll have some time at the end to ask some questions, but let me turn now to Brian Dittmeyer, who is the Senior Public Counsel at the National WIC Association, and he's going to describe a slightly different method of trying to do a survey of WIC providers nationally. So, Brian?
Thank you. Thank you all for having us on this webinar. It's certainly been a challenge in our community to get accurate data as well. So Myra, thank you for your opening. I think it really laid out some of the struggles that we've all faced as we're trying to wrap our heads around how best to communicate and message out this issue. So I'm actually going to jump off of this slide as well, because I think Myra put it so perfectly. Reputation, restraints, and resources, the 3 R's all summarize issues that we faced in the WIC community as well. We know particularly restraints around the fact that we don't ask certain questions about immigration status when introducing people into the WIC program, and certainly the effects of resources and the limitations on our WIC clinics when we have to focus on our public health mission and how can we collect and advocate on this issue that intersects so clearly with our public health mission, but when we are already so short-staffed and with limited resources in the first place. So if we move to the next slide, I'd love to provide some context of what we faced in the WIC community. As with all of us, we started hearing a number of anecdotal stories come out in the beginning of 2017, and we had put out a call for stories to get a sense of the scale of what our community was facing. But over the course of 2018, as the rumors continued, we weren't clear whether WIC would be included in any public charge effort or any limitation with immigration restrictions. It really was in the beginning of 2018 when Reuters and Vox.com started publishing leaked drafts of the public charge regulation that we found WIC named in a possible policy change to the point where we started to have some really consequential impacts among our participation. And so we revamped our call for stories and turned it into an updated survey and put out a request for information from our clinics. And one of the goals of the survey was really to demonstrate that the impact was felt widely. It was not just in high immigrant communities, it was across the nation. And within the first couple of days, we received 150 responses from over 31 states, including some states you'll see on the map there that wouldn't necessarily be considered high immigrant communities. And so we were able to demonstrate both in our public-facing messaging, but also in our work here in Washington, D.C., we were able to demonstrate that this would have a significant impact on the program nationwide. And so we know that we were able to mine stories from our survey and lift it up in our conversations, in our public-facing messaging. And I think one of the advantages of it was really keeping it open-ended and letting people tell what they were seeing and what challenges they were facing. And so we created a number of opportunities throughout the survey where folks could have an open text box where they could share what they want, which is one step before going for a more targeted focus group, which Myra was talking about, and you can really get a lot of information from hearing from people directly. And it illuminated some certain facets that I think were important to our conversation. Perhaps the most important element that we uncovered through the survey, which certainly has become more widely acknowledged, are some of the pain points in the process where people were getting their information from in-language media sources that were elevating the public charge discussion, and from immigration attorneys who were offering very ironclad advice to get off all government programs. And so that helped, and to borrow Myra's term of power and partnerships, that helped us identify where we needed to engage more as well and to talk about what WIC is providing, but also how WIC is connected into the immigration story as well. And so we reached out to some of the partners within PIF who could help us talk to immigration attorneys, who could help us talk to in-language media sources, and to build out that conversation as a whole community came together around public charge in 2018. Another element that we came to identify throughout the survey as well was the diversity of where people were being impacted, both in different language communities, so moving beyond Spanish into Chinese, Somali, Nepalese. We heard from the survey that all of the different communities were certainly being impacted. And then the diversity of when it's happening in the process. So one issue that came up a lot was student visas and how that distinguishes from the more family-based petitions that we were considering, and how it manifests, particularly in our early childhood space, how the public charge rule was being interpreted and inspiring fear throughout the community. So that informed how we moved as an organization. Again, our public-facing messaging, our conversations here in Washington, D.C., but also the types of documents and resources we put out. So we developed a frequently asked questions document around public charge that was aimed at participants. And again, coming out of the survey, we identified what languages we felt were necessary to translate the document into. Outside of Spanish, we translated it into Chinese and a whole host of other languages as well. And frankly, that had been really helpful to provide some information about where WIC stands in the public charge process. And so that when folks are at their WIC clinic, they get some information about public charge, and they can then have a broader conversation in their family, in their community, and with their immigration attorney about how they'd like to proceed with their WIC benefits. And if we move to the next slide, I'd just like to highlight that we then used this information out of our survey, both in our conversations with media and within our community at large. So we were able to connect a number of the providers who had responded to both local and national media sources. And in early September, a few weeks before the public charge rulemaking public comment period had started, there was a landmark piece around the WIC program in Politico that documented the chilling effect and included several WIC providers, some of whom had been connected to the issue through our survey that had gone out earlier in the year. So we found it as a wonderful place to not only collect some frontline reactions, but also to identify advocates and champions who were willing to speak out on the issue, who were willing to get engaged with national media. And one of them, her name was Jennifer. She's a provider and Spanish interpreter in Kansas, has really been outspoken on the issue, has sat for a number of national interviews, and was able to address our national conference this past spring in Baltimore, where she continues to educate the WIC clinics that aren't seeing this issue fronthand and to mobilize our community around this issue. And she had played a large role in raising awareness throughout the public comment period as well, where we were able to get WIC clinics and WIC agencies and WIC staff actively engaged in the public comment period, even when WIC was taken out of the proposed rule. So we felt that that was really important to mobilize our community, and we were glad that the survey helped identify us with those champions. And so we really saw the value in that. With that, I'll turn it back to Ignatius.
Thank you, Brian. So we're now going to go to Meg Davidson and Francesca Costa from the San Francisco Marin Food Bank, who have been documenting what they're seeing through their community outreach staff. So Meg is the Associate Director of Policy and Advocacy at the San Francisco Marin Food Bank, and Francesca is the CalFresh or SNAP Outreach Program Manager. So Meg and Francesca.
Thank you. Could you move to the next slide, please? Great. Thank you so much for having us on the webinar. My name is Francesca, again, CalFresh Outreach Program Manager here in San Francisco. And thanks again for having us on to the webinar. I should just mention we're based in California, where we refer to SNAP as CalFresh, so that's what we'll be calling it today. And basically the goal of the CalFresh Outreach Program at the San Francisco Marin Food Bank is to increase participation in CalFresh, because in California, we're not doing a great job of enrolling folks in CalFresh. Most recent estimates are that about 72% of eligible Californians participate, so a lot of folks are still missing out on the program. I should also mention that in California, our programs are county administered, so we work with our county collaboratively to improve CalFresh participation. And as you can see on the slide, we have two main strategies to serving the community. One is what we call direct service. The other one is indirect service or capacity building. Direct service is what it sounds like, so working with folks directly to help them through the CalFresh application process, address any concerns that they have, and really support the whole process and after enrollment as well. And indirect service is working with folks who are basically working at community-based organizations, social workers, case managers, trying to build capacity within their agencies so that they can also serve folks who are applying for CalFresh. And I should mention one of the main reasons that we have continued to do direct service is that we really want to make sure we know what's going on in the ground and can relay that information back to our county. And so you'll see also we included a map there. It's called the racial dot map, and it just shows the geographic distribution of residents of San Francisco. And we illustrated this just to show that our service area encompasses an incredibly diverse population. So we serve a ton of different immigrant communities in San Francisco. So the map that you see there is every dot represents a single person. So this is census tract level data. And the population that we serve, the diverse population, is a subset of this overall population map, but it gives you a good sense of who the people that the San Francisco Marin Food Bank is serving. Next slide, please. So just to continue with a bit of, a bit more background information. So according to the UCLA Health Policy Research Center, in California, there's about 860,000 people who would be impacted by the chilling effect.
And so 91% of those are Latino, 7% are Asian, and 2% are white. And this information just helps us understand who is going to be impacted. And you'll see the chart on the right there illustrates that there are 3 possible disenrollment scenarios in the Bay Area. And studies of welfare reform have shown that immigrant disenrollment from public benefits, even when people are qualified, because they're confused or afraid, they range from either 15% to 35% for all non-citizen immigrants, and then up to 60% for refugees. So we just knew that there was a lot at stake here, including potential $74 million loss in benefits across the region. And so that scale was really staggering, and so we felt even more compelled to engage and try to learn more from our clients experiencing the harm. And the second chart there, so kind of speaking to what Myra was sharing about reputation and resources, we're a nonprofit, and so we don't really have a team dedicated specifically to doing this kind of on-the-ground research, but we do have a really great partnership with our Human Services Agency here in San Francisco County. And so we worked with them to get some information on trends they were seeing in their own caseloads, just to see whether or not they were aligned with what we were hearing and feeling on the ground with our on-the-ground staff. And so what you see there, that top line, so the overall caseload had fallen by 8%. So that's that top line of the chart as of the end of December 2018. So most of that drop was attributed to the decline in non-citizen cases. So if non-citizen cases were excluded, the caseload drop would only be about 2%. So you see the non-citizen cases line, it's pretty staggering. It dropped 13%. And then cases that have an undocumented household member, as well as cases in which the head of household is undocumented, dropped 31%. So it is very strong here in San Francisco in the Bay Area, what we're seeing in terms of disenrollment. We're definitely edging much more closely towards that 35% and towards the 15% scenario. Next slide, please.
All right, so in terms of the folks that we've served historically, our outreach team has always focused on serving the immigrant community because we know that folks tended to be under-enrolled. So when the public charge rule was proposed, and also, of course, the different leaks that happened in the year previous to the public charge rule actually being proposed, we were kind of at the front lines working with folks through this fear. And a lot of the work that we had done for many years was to assuage people's fears, specifically around public charge. So we definitely felt a sense of responsibility in terms of doing anything that we could to contribute. And we knew that we had unique access to impacted communities. We were sitting down with folks, talking to them about their concerns every day. And outreach also became very tough. Our outreach staff said that folks were even avoiding them at pantries, one of the main places where we do outreach. And outreach staff were in a position where they were questioning if they were even serving the community anymore. So when we talked to our partners at the California Association of Food Banks, and we're working obviously under the guidance of the information that we were getting from the PIF campaign, we knew that we could contribute to the national data set by collecting client stories. And one thing that we've been told basically since the election from all kinds of advocates is that having these stories is really the best way that the direct service folks can contribute to that intersection of policy advocacy and direct service. Next slide, please. So we created a standard form to track the chilling effect. It was just a Google form, pretty straightforward, and really the goal was to be able to figure out what was going on in the 2 counties we serve, so San Francisco and Marin, and to be able to capture situations in which our outreach staff know that they talked to 40 people at a pantry who were concerned, or they have one individual's, full story. So some of the things that we asked were how many clients are concerned, what neighborhood are you in, what is the person's citizenship status? And I should mention we stopped tracking citizenship status after the election, just for wanting to maintain the utmost privacy. We tracked the language, any salient quotes from the client, what the outcome was. Other things that we tracked were, what concerns did they cite? We ended up opening this up to other folks at the food bank so that they could also track if folks were disenrolling from pantries. And I should just mention that didn't really get a bunch of traction with them. So in terms of the data that we were able to collect, we tracked concerns from about 72 clients total. There were 33 instances, so some of those were groups of folks, 24 from San Francisco, 9 from Marin. The majority was of Spanish speakers, but the largest population that we serve is Chinese speakers. And so it came out to about 57% Spanish speakers and 42% Chinese speakers. We asked if folks were concerned about CalFresh or other programs with a drop-down option, and everybody that they talked to was concerned about CalFresh, which is not surprising because that was the program we were talking to them about. But 4 also cited concerns about Medi-Cal and 1 cited concerns about Section 8. Next slide, please. And then, so what we feel the Google form did the best job of was capturing stories and anecdotes that can be used as tools for advocacy. And we were able to use that in the public comments for the proposed rule change.
We were even able to include some of the more salient quotes that we got from clients in some of our outbound advocacy alerts when we were soliciting public comments from food bank supporters to contribute during the public comment period. So being able to give voice to this population when we were asking people to take action and submit public comment was very powerful.
And just to walk you through some of the quotes that we received, I'm afraid it will cause some negative impacts when I try to become a U.S. citizen in the future. Furthermore, I don't want to bother my sponsor. And I should mention in the Chinese community, that was a concern we saw time and time again, was concern around sponsorship. I've heard from people that receiving CalFresh will affect my ability to gain legal status. My lawyer has advised me not to apply for CalFresh. And this is something that we definitely feel is an opportunity for growth and collaboration going forward, is to be more connected to the legal community, because definitely in our service area, folks were being advised not to apply for any public benefits. And
I'm considering disenrolling from CalFresh. I was once deported a few years back, and I'm worried I may be deported again due to CalFresh. And finally, I've heard rumors that receiving CalFresh will prevent me from being a legal permanent resident and that my children will have to pay back what they received once they are older. That's actually a concern we heard quite a bit. Several different people, I'm not sure where that rumor originated, that their children would end up being held accountable for whatever benefits they received. So it's definitely something we tried to combat across our service network.
Right, and then just to expand on the chilling effect, it definitely was the main issue for our clients, because when we would explain all of the background and the loopholes in the public charge consideration, some folks were still interested in applying, but definitely a lot of the concerns that they were mentioning were not even concerns that were explicitly mentioned in the proposed rule change. And next slide, please. And then finally, to explain a little bit about the tracking challenges, I would say the main concern is that we knew that this data that we have is very underreported. As one of our frontline staff said, I had a hard time keeping track of who I spoke to about public charge. Topic and conversation came up at almost every outreach event that had a Latino population. I think because it was such a common thing, it was just hard keeping track of it. So we know that staff were, overburdened with trying to have these conversations time and time again. It became so commonplace that they would forget to write it down. Another concern that came up with other staff was that, because these are not individual level concerns that were being cited, she was concerned that when she was going to the same outreach location, that she might be double counting folks. So overall, I would say, we feel like we did a great job of being able to connect these anecdotes to, their furthest possible end goal, but we wouldn't say that the data is comprehensive, and we would say confidently that it will really underreported. And I should just mention that we'd be happy to share any of the information they've compiled for any efforts that can be used to fight back against the proposed rule change and its implementation, and we'd also be happy to share a template of the Google form for anybody who's interested. Thank you.
Back to Ignatius.
Hello? Hi, Ignatius. You may be on mute. We're not able to hear. Oh, there you go.
There I am. Sorry about that. So next we're going to turn to Hamatal Bernstein, who is the Senior Research Associate, and Elaine Waxman, who is a Senior Fellow at the Urban Institute. They have recently published some really important data about the chilling effect that we will discuss at the research working group. But Hamatal and Elaine are going to make some comments from a research perspective about how researchers might support some of these more community-based efforts.
Great. Could you advance the slide? So I'm Hamutal. I director immigration work at the Urban Institute, and I'm just going to share a few words on Urban and the research work we've been doing. The Urban Institute, for those folks who are not familiar with it, it's a nonpartisan research organization in Washington, D.C. We conduct a wide range of social and economic research, and that ranges from looking at big trends and collecting and analyzing data to analyzing the effects of policies for people's health and well-being and finances, to working with community-based organizations and public agencies to support data-driven practice. And to engage on the public charge issue, really try to understand the impacts that the broader immigration policy climate is having on the ground for families, children, and organizations. We've been bringing together experts here at Urban from the healthcare space, nutrition, education, and other human services areas. We put out a couple commentaries and a research brief during the comment period, and we're also now starting to share what we learned from some news survey and interview results, original data that we collected this past winter. So it was really interesting. Thank you to the other panelists so much for sharing what you've learned through your work. We've picked up on a lot of similar themes and would love to hear more. And so we released a brief last week that Ignatius mentioned, showing that many immigrant families are avoiding participating in non-cash benefits programs and that these chilling effects are spilling over beyond just those directly affected by the rule. We'll be releasing another brief on reported changes in daily behavior and avoiding interaction with public authorities. Those are drawing from this national survey data. And we also have a third report coming out this summer, which will share sort of more in-depth information. It's going to draw from 25 qualitative interviews that we conducted in March with adults and families who had experienced some chilling in 2018. I will turn it over to Elaine to talk about our work on developing a monitoring pilot and working with community-based organizations.
Sure. Thanks, Hamutal. And thanks so much to those of you who already shared sort of the opportunities and challenges on the ground. Hamutal is our immigration expert. I come to this more from the perspective of having worked with a lot of community-based organizations on data challenges. And so our current effort in very early stages is to work in a different kind of community than the ones you've heard about in California, one that is less friendly to immigrants, although obviously even in a state that's relatively welcoming like California, there are huge issues. So our goal is to actually work collaboratively with providers to figure out how they're hearing about issues right now and what might be feasible for them in terms of their capacity and their ability to capture information. And then once we've done some of that exploration, our goal is to sort of test a more feasible and systematic approach for documenting evidence of chilling that outlines some common data elements, confidentiality procedures, training that staff would need, and potential ways that that data might inform the work of an organization in the larger field. Next slide. And so, as you've already heard, it's really challenging in part because whoever is likely to collect this data is already engaged and very focused on their day-to-day work. And so one of the things we need to figure out is how to make this as low burden as possible. And that can look really different depending on what kind of provider you are. So, for example, a federally qualified health center is going to be used to primarily doing things in electronic medical record often. Whereas a food bank may or may not be automated in some of the ways it's collecting information. And other organizations who work with immigrant populations may be doing things more from case files. There's also organizations that may have hotlines. That's another way of capturing either information that people report or even the trends in dropping off of interest as been flagged. So there are lots of different domains that people are likely to encounter, and what we'd like to do in this pilot is work across three of those major domains: healthcare, food security and nutrition, and those working on immigration services generally. So what we will do is interview and work directly with providers to understand how they're already hearing about chilling. In most cases, providers are not likely to be really comfortable asking about it, and that's not necessarily something to be recommended, but certainly they may come across instances where people volunteer it or raise anxiety. We'll want to talk about how that's coming up. And then what are the most practical ways, given the way they normally track information, that they might be able to do some really basic de-identified data collection, and what are ways of what concerns them about doing that, because obviously they may be concerned about how it might impact their own conversations and relationships with clients, and we would not want to further chill the ability of providers to do their daily work. It's helpful also for providers and to think maybe collaboratively about why it's so important to do this systematic documentation, that it may ultimately inform litigation, that it can also help them understand how to adjust their services, as you already heard from, for example, our friends at the San Francisco Marin Food Bank, that they've already been thinking about how it impacts their outreach. So the idea is to do this in a pilot city. We're still working out the logistics, so I'm not going to say where, but it would definitely be a less immigrant-friendly environment. And then use those learnings to test a format across these domains to see how common we can get it across those domains, or whether realistically you have to adjust depending on the kinds of work. I think we also need to think about the confidentiality of information, even transmitting information. Say we decide we want to collect that in some kind of central fashion. Just using an Excel form and in a regular email fashion may be of concern, so we would want to think about password-protected files. In some places, you may even want people who would use an encrypted app to transfer information. So unfortunately, we have to think about those things and how to make people feel as safe and secure as possible, even if we're taking names off. If there's enough identifying information on there about race or other status, it might cause a concern. So those are all things that we hope to explore over this summer and into the early fall, and piloting this sort of initial capacity of providers to even do this in a systematic way, figure out what the data quality issues and process challenges are, and refine as we go. And then think about what those insights are and how that could inform potential scaling in that particular community, but also in other types of locations, since each we know is going to have its sort of own idiosyncratic needs. I'll stop there because I know we're running tight on time, but we'll certainly look forward to talking with you all further if you're interested in this particular project.
Great. So this is Ignatius, and we're running short of time, so I'm just going to ask one or two follow-up questions. But if we can advance the next slide, Hamutal and Elaine have their contact information up, and so folks can jot that down. But again, we'll be sharing the full slide deck with everyone afterwards. So I'm going to go back to Meg and Francesca and ask if you can comment about what training or orientation you did with the frontline staff about collecting or documenting these incidents and cases, and how difficult that was for them, and just sort of that reality of them being really, really busy and trying to do their outreach, but this was an additional task that you asked them to do.
Yeah, great question. Thank you. So I would say post-election, we took advantage of any trainings that were open to the community, including trainings that were client-facing. So we all attended Know Your Rights trainings that were provided, and definitely looked to the Protecting Immigrant Families campaign for webinars and materials. Really read through a lot of the Q&A documents that were super, super helpful, invaluable, in fact, and different things that were available through NILC as well. And so I think we kind of just did our best to make use of the resources that we had available. we also have built in some trainings for all food bank staff around vicarious trauma trainings, which I feel like were really, really helpful for this particular moment, given that our frontline staff come from the communities we serve. And so in terms of challenges, I mean, I think this was kind of an outlet for folks to be able to say, like, okay, at least I can elevate this person's story and pass this on, and hopefully it will at least mean something, because, you know, the work was really, really challenging. I think speaking for our staff, like a lot of us got involved in this work because we really enjoy the opportunity to be able to serve the immigrant community, knowing that resources are hard to come by. And so definitely emotionally challenging, and, you know, just doing our best to kind of keep things moving as much as possible.
Great, thanks so much. So last question, Myra, if you're still on. When you did your surveys, you really emphasized the importance of partnerships and working through the existing networks of organizations like the California Immigrant Policy Center and the California Primary Care Association. So when you did the surveys, again, same kind of questions. Did you just send it out by email? Did you have to do a lot of follow-up by email or phone to get responses? Talk a little bit about just sort of the practicalities of all that.
Sure. And to your point about the follow-up, we actually had to do a lot of in-person outreach with folks. We utilized organizations on the ground to distribute the survey. So if they may have sent it electronically, they may have talked to somebody while they were in their waiting room, but everybody from promotora organizations like Visión y Compromiso to the actual immigration serving organizations on the ground, so Siren, Cares, and Chidla, I don't know who, there's a number of others that were engaged, and they then spread the word with their network and members. So I think it really made a difference to have people that were trusted resources asking families themselves to fill out these surveys. So again, that's even more research intensive. And I will say, for the time and effort that people that helped distribute the survey, we did provide a very small amount of resources to compensate for their time. Obviously not enough to accurately cover that time, but it was a symbol of appreciation that I think people appreciated.
Great, thank you. So then in the final minute, I'm going to close by turning it over to Renato Rocha, who is from CLASP, one of the co-conveners of the Protecting Immigrant Families campaign, and he's going to talk about how you can get involved in PIF, and then we're going to have some follow-up discussions in the research working group, which he co-chairs. Renato?
Hi, thank you. So hi, everyone. My name is Renato Rocha, policy analyst at CLASP, and co-lead the research working group with David Kalik from the Fiscal Policy Institute. If we can move to the next slide, that would be great. So, and if you can bear with me for just a few more minutes, I know we're right at the hour, but I do want to hear about how folks on the webinar can get involved with the PIF campaign and the research working group. So on the screen in front of you, you can see that there are multiple ways to get involved with the PIF campaign. You can join our email list, and this is where you can stay up to date on news, developments, and potentially other threats that impact immigrant families. You can become an active member. Currently, we have more than 350 organizations across 36 states that are active members, including 159 national organizations and 220 state-based organizations. There are absolutely no fees to join, and this is really how you can participate in the many working groups of the campaign. And this is where a lot of the work gets done as we move forward with the campaign. We have 5 working groups as part of this effort. One is the Federal Advocacy Working Group. Another one is Policy and Legal Analysis. We also have Communications and Field. And lastly, the Research Working Group, which you'll hear in just a second. There are other ways to get involved as well, including sharing your story and lived experience. And if you follow that link in front of you, we'll be able to follow up with you to have a more in-depth conversation, and we'll never share your information publicly without your permission. And lastly, you can also regularly check out our events page on the campaign's website for more information on ways to take action to support immigrant communities. Can you move up to the next slide, please? And now I want to take a moment to share more about the research working group and invite those who are interested in getting involved in this work to participate in this group. So the research working group convenes researchers, academics, analysts, providers, and others who are engaging in research agendas about immigrant access to public benefits. And last year, thanks to members' hard work, the campaign had much needed analysis about the potential impact of the proposed public charge rule. And it was, this analysis that was highly cited and really used in comments throughout the campaign that were submitted in opposition to the proposed public charge rule and really helped us illustrate some of the harm of the rule. And this year, a big bucket of our work is preparing for anticipated attacks to immigrant families, including gearing up if the DHS public charge rule is finalized. And as a part of this preparation, the working group is serving as a hub for researchers to discuss their upcoming projects, to support research on the impact of public charge, including documenting the harm, and is sharing new research or findings throughout the campaign as it's made available by researchers and other members of the working group. So I'll quickly add that we have a standing call the second Wednesday of every month. And if you fill out that active member form that you saw on the previous slide deck, you'll be able to join this working group and our other working groups that are available through the campaign. And you can also fill out that form at our website at protectingimmigrantfamilies.org. So I just want to quickly pass it back to Ignatius to close us out.
Thanks, Renato, and thanks to all of you for staying with us a few minutes over. As we said, we will share the slides back with you. We encourage you to plug into one of the working groups like the research working group if you have not, to join the active member organization and stay in touch, because there was much more to do to reassure our immigrant families that they can continue to receive these benefits and that we are fighting with them against these policies in the future. Thank you all very much and have a great day. Bye-bye.